Welcome back to my channel. In this video, I'm going to talk about some contact lens take care or take home messages for the beginners. It's a beginner level video. If you have questions at any level, please ask me in the comment section. We can go over that. Okay, so let's go over the agenda. In this video, I will talk about introduction, how to put the contact lens on and how to take them off, and precautions are extremely important. I'll go over the precautions, and then troubleshooting. If anything happens, common problems, how to troubleshoot. Okay, introduction. So contact lenses, it's a thin curved plastic material. If you're wearing soft contact lenses, there are different types of that. So thin, very flexible, soft contact lens. Sometimes we have to do hard contact lenses or sclerals or RGPs. There are different types of that, and there is a hybrid lens also. So there are types of that. Okay, so it's a typically used for the correction purposes, but sometimes you want to do it for the cosmetic reasons. So it depends what you're using it for. And again, it allows the comfort of the eye from so many perspectives, and of course you're seeking a good vision as well. So how to put them on, it's extremely essential to know that the technique is important. So you just you have to make sure that your technique is good. So for me, I have to have every starter patient trained. We do it as an INR, insertion and removal training for my patients. My staff does it for me, and I supervise it to make sure they're doing safely for the rest of their life. So first and foremost important thing in this regard is wash your hands, use the soap and the water, dry with a lint-free cloth. Okay, you have to do those steps because everything is important in every step. Prepare the lens, check the prescription. You make sure you are checking which one is right lens, which one is the left lens, which one you're putting it on, and ensure that the lens is not inside out. You have to make sure it's in the appropriate bowl fashion. Okay, and then control your eyelids. You have to have a really good control on your lids and use your fingers to hold the lens. Okay, so one finger holding the lids, the other hand is topping the lens on it, and then you insert it. And insert the lens, place the lens on your eye, not on the lashes, because sometimes the bacteria on the lashes can get translated onto your cornea during this process. So you make sure you are not introducing your lens to your lashes. Just go straight to the eye surface itself, the cornea. Okay, and when you're taking it off, you have to wash your hands, ensure the hands are clean and dry. Control your eyelids. Again and again, I'm emphasizing the lid control is extremely important. And open with your finger. Okay, and pinch it. You have to pinch it, but pinch very gently. Some patients pinch it so hard that it crushes the lens. Please don't crush your lens. If it crushes, don't put it back. Make sure you throw it away, because a crushed lens, even if it's partially crushed, it could be a source of injury to your cornea. So you don't want that. Okay, sometimes easier thing is you slide it to the white part of your eye and then pinch it out. That makes it easy for so many patients. Important precautions, do's and don'ts. What are those? Wash your hands, wash your hands, wash your hands, wash your hands. I cannot emphasize enough, please wash your hands, because that is a big problem. Many patients don't wash their hands and they keep having infections. Clean and disinfect the lens. Use a good solution, put it in there to disinfect it, and store your lenses in their case each and every single night. Okay, do not do certain things. For example, do not sleep in the contacts. I have a separate video on that. I went over what happens if you sleep in your contacts. Don't wear the lenses longer than the prescribed time or recommended time duration. Do not cross that. Do not use tap water. Some people keep using tap water. Please do not use tap water to clean your lenses. That's gonna be a big problem. Troubleshoot. Number one problem some people have is discomfort. So artificial tears are really good. They lubricate your eyes, and proper fit is important. If you have a discomfort and your lubrication drops are not helping, it could be a fitting problem. So proper fit is important. Ensure that your lenses fit well. Consult your eye care professional if the discomfort persists despite artificial tears. And sometimes consider using daily disposable contact lenses, because sometimes if it's not helping with artificial tears and the fit correction, dailies are the best choice, because in monthlies the deposits collect in there. Sometimes your eyes are having very thick secretions and they can collect in the contact lenses and make it worse. So monthlies are not a choice in that kind of scenario. Dryness, stay hydrated, drink a lot of water, especially if you're living in a hot boiling state like where I am living in. And environmental factors are important. Use humidifier if you need some humidification around you. Blink regularly. Many times you forget to blink and it dries out your contact lens. Please lubricate and blink properly. Lens damage, proper handling is important. Always wash your hands before you handle the lenses. Avoid water. Never expose lenses to tap water or saliva. This does happen, that's why it's written in the publications. And replace as recommended. Replacement schedule is there for a reason. You cannot just keep wearing a daily disposable for the whole year or a whole week or something. Some people do that. I see them all the time and I tell them, and then they say, oh, nobody told me. Well, it's impossible. It's written in your prescription printout as well. So please check it. Please go over the material. If you have questions, ask the person who is prescribing or the office. Call us. We can answer you. Email us. Whatever way is easy for you. So ask me in the comment section if you have gone through a lot of complications or any complications. You are most welcome to ask me in the comment section. Okay, we can go over that. Thank you so much. Have a great day. Bye bye.